Hello, my name is Thomas J. Fitzgerald III, Director at the VA Palo Alto Healthcare System and proud United States Army veteran.
And I'm Michelle Mountfort, Interim Associate Director for Patient Care and Nursing Services.
VA Palo Alto Healthcare System is proud to stand strong, providing quality health care and patient experience to all of our veterans. As the COVID-19 situation continues to evolve in our community, our healthcare system has taken steps to limit the spread of the virus and other respiratory illnesses. It's essential to protect our veterans, staff, and visitors, and our community.
We wanted to take this opportunity to introduce best practices about personal protective equipment, or PPE. In this training video, multidisciplinary staff get a close look at what it takes to care for a COVID-19 patient and how to prevent exposure and contamination to yourself, others, and the environment.
I am always proud of our staff and their commitment to taking care of veterans, taking care of each other, and taking care of our community. We all can do our part, and VA Palo Alto is leading the way. Thank you.
Hi everyone, my name is Lindsay Bradley. I'm the acting critical care nurse educator, and we're going to talk a little bit about using the PAPR and PAPR safety today. So the first thing to know about the PAPR is that there are two different types of face shields. You have a small medium and you have a medium large. The medium large fits about 85% of our staff members, and this is usually what you'll find on the units. A small medium can be used if when you apply the PAPR you find there's a lot of air movement either around the sides of your face or underneath. If you're having trouble getting it to fit, I would recommend contacting someone who's experienced in placing this to help you determine. The next thing we're going to talk about is the PAPR itself. The PAPR is situated like a helmet. There's a HEPA filter on the top. The HEPA filter is good for about 1 year, and when it needs to be replaced, this will be replaced by biomedical engineering. This is not something staff on the unit need to worry about. Inside the PAPR, there's a couple of different things to look at. You have your adjustments for the helmet by turning the bar. You also have this disposable foam piece in the front. If this becomes soiled or dirty, you can actually remove this using the Velcro and change it out for an alternate one. This shouldn't be done routinely, only if it gets soiled. The item in the back should not be removed. This should stay permanently. On the bottom here is where you can see the air filter adjustment. There's 3 settings. The lowest setting is setting 1, medium is 2, and 3 is high. This is kind of like adjusting your air conditioning. If you adjust it to a higher level from 1, you will use your battery life more, go through your battery quicker. There's also a couple of different lights to see. You can see the reference below. A yellow light when you plug in the battery says that your HEPA filter needs to be changed or repaired. A green light when you plug in your battery means that you have battery life left, and a red light means that you're out of battery. You have less than 25%. There's actually 3 different colors of the green light that you might see. 3 green lights indicates you have 75% or better, 2 green lights indicates 50 to 75%, and then 1 green light indicates 25 to 50%. We'll demonstrate that when we plug in the PAPR. When you plug in the PAPR, you should hear an audible click. You're able to see the lights there. So you can tell there's 3 green lights there. There's 3 green lights. You're able to see this as soon as you plug it in, representing that you have at least 75% of your battery to use. If you don't see 3 green lights, if you see a yellow light, a red light, or 1 green light, we recommend changing out your battery or changing out the PAPR helmet, whichever is required. When removing the PAPR from the battery pack, you can press down on the black tab and remove. If you need to adjust the helmet once it's on, you can tighten or loosen using this back headpiece.
Try it on?
Sure. So this is where you have the title, the medium large or the small medium up at the top.
Okay. This one.
You can peel off the film so you can see. And then pull out the wings. Does it feel snug?
Yeah.
Okay. Can you feel where the airflow adjusts at the back?
Mm-hmm. Yes.
Okay. And you can see the green lights if you look towards the middle?
Mm-hmm. 3 green lights.
Okay. Great. Thank you.
Thank you.
Hi everyone, my name is Lindsay Bradley. I'm the acting critical care nurse educator. We're here today to talk a little bit about donning and doffing of PPE for patients that are diagnosed with COVID-19 or also under investigation. With me today is Wendy, a nurse from the IICU, who will be playing our safety officer, as well as Mary Lou from 2C, who's actually never been through this process. So you're going to see a real-life training in this video. We're going to go through all the required PPE that's required for nursing service personnel, as well as personnel from other services to enter the environment. We want you to pay close attention to the steps that we're following on the checklist. However, they may vary in your environment because these are constantly changing and look slightly different between 7H, 4A, medical surgical, ICU, and the emergency department. Please pay close attention to the steps for your department as they may vary. We're going to go ahead and let Wendy start the training process.
Hi, Mary Lou. So first, we're going to perform hand hygiene. We're going to gather the following items. We have your VA issue scrubs, yellow isolation gown, bouffant cap, shoe covers, PAPR helmet, PAPR disposable lens cuff, PAPR battery, and your Vocera for nurses. So then we're going to come over here for instructions for donning with the PAPR. We want to place all the supplies on the table as we have here. First, we're going to put on VA provided scrubs on top of your personal clothing. So you want to get one size larger than what you currently have. We're going to put on your top scrubs first.
Do you want it tucked in or out? Is okay. It has to be tucked in.
Either way, it's fine.
Okay.
All right, then we're going to get our shoe covers. And you can sit down and put those on. All right, next, we're going to perform hand hygiene. Next, take your bouffant cap and put it on. All right, I want to make sure all your hair is tucked in. Perfect. Now we're going to put the disposable length cuff on your PAPR. Next, get the PAPR battery and clip it on your bottom scrub.
Front or back? What's your suggestion?
Probably somewhere
On
where
the
you can
side?
reach it on the side.
Okay. Ooh, this was hard to clip. There you go.
All right, next grab your Vocera and put it on your top scrub. Now take your yellow isolation gown and put it on. You will leave the tie untied for now, and we will then put on the PAPR helmet first.
Is there an opening on the side?
Fix Want to make sure your bouffant cap. There. All right. Now you want to take the PAPR cord, put it to your back and underneath your gown.
The yellow gown?
Underneath the yellow gown. And take the battery and plug it, take the cord and plug it into the battery pack until you hear audible click. There. You want to check the PAPR fit by leaning forward and from leaning forward from waist and or moving your head from side to side. Make sure that is a good fit. Yeah. All right. Now you want to tie your gown on your back.
It's backwards, okay, then.
Tie in the front. Last step is to put on your gloves. Now you're ready to enter the room.
All good.
All good?
Wendy, I'm ready to doff. Can you guide me through the steps?
Yes, I can. So instructions for doffing with PAPR. You want to place one chuck pad on the right side of the table for a dirty PAPR and put your PIV card there. Remove your gown by pulling it away and rolling it inside out while removing your gloves. Throw it in a regulated medical waste bin. Do hand hygiene. And put on a new pair of gloves. Grab and open a plastic bag. Place it on the left side of the table and keep it open. Remove the disposable lens cuff from the helmet by grasping both sides and pull it away from your face and make a fold. Throw it in the regulated medical waste bin. Remove gloves and perform hand hygiene. Now put on a new pair of gloves. Next, you want to loosen the headband knob while holding the helmet with the other hand. Lift the helmet off of your head and place it on the chuck on the table on the right side. On the right side. Now unclip the battery pack and disconnect the power cord and put the battery on the chuck on the table as well. Now remove your bouffant cap and throw it in the medical waste bin. Remove your gloves and perform hand hygiene. Put on a new pair of gloves. Unclip your Vocera and put it on the chuck on the right side of the table. Now get a Super Sandy Cloth purple wipe, open the package, and use that to clean your Vocera.
I just toss this here.
Yes.
Doesn't matter.
Place the Vocera inside the open plastic bag to air dry. Throw the wipe in the regulated medical waste bin. Now open the PDI AF3 gray top container and pull out a wipe to clean your PIV card. Place that inside the plastic bag. Now take your PAPR battery, clean it, and also put it inside the plastic bag. Now lift up your helmet and gently clean the inside part of your helmet. Make sure you do not pull on the plastic liner. Then clean the outside part of your helmet. At the same time, avoid touching your helmet back on the dirty blue chuck. And when you're finished, you want to use your PDI wipe to hold onto the cord. Place the helmet in the bag while cleaning the cord, and slowly placing the cord inside the bag. Throw away the used PDI wipe. Throw away the chuck on the table. Remove your glove. Do hand hygiene. Put on new gloves. Now remove your top linen, scrub. You could put it in the linen hamper. Remove your bottom scrub and put it in the linen hamper. Place one chuck pad on the chair, and you can sit down to remove your shoe covers. Discard your shoe cover and the chuck in the waste bin. Remove your gloves and perform hand hygiene. Put on new gloves. Grab the plastic bag with all your PAPR and items. You are now safe to exit.